Before I had this surgery, I was miserable. I was very depressed. I didn't want to go anywhere. I isolated myself from people. My relationships with my husband just went down the drain. I had high blood pressure, high cholesterol. I had arthritis in my back.
My health before bariatric surgery was pretty bad. I had diabetes, high blood pressure, high cholesterol, just something a 40-year-old shouldn't have to experience at such a young age.
I was pretty sick, and I didn't realize how sick I was. I had high blood pressure, high cholesterol. I was a diabetic, and I knew that shortened my life.
Hi, my name is Dr. Jeremy Korman. I'm a bariatric surgeon. I know that making a decision to have weight loss surgery is a very difficult decision, but we're here to help you. We're here to guide you through this process, to guide you through this journey.
One thing that people are worried about when they come in is that we're going to change their lives drastically. And actually, they're right. We are going to change their lives. We're going to change their lives for the better.
The ideal candidate for weight loss surgery is someone who actually recognizes the negative impact that their obesity is having on their lives, and they're ready for a change. There are three operations that we perform: the LapBand, the sleeve gastrectomy, and the gastric bypass surgery. The LapBand is an operation that's been around for about 10 years. We place the band around the upper portion of the stomach. We achieve a certain compression that's appropriate for the individual, and once we achieve that compression, we get our expected outcome, which is where someone will lose at least half of their initial overweight. The unique advantage of the LapBand is that it's a reversible operation. It's something that we can remove, and the stomach anatomy goes back to its original state. But its limitation is that the weight loss tends to be less statistically over time. And another limitation is that we are dependent on a foreign body or device to achieve this. Second operation is the gastric bypass surgery. The gastric bypass surgery I like to think of as the most aggressive approach. What we do is we divide the stomach near the top. We completely divide this area away from the remainder of the stomach, and we make a new connection to your intestine. We're bypassing the rest of the stomach, which has a function, and this rest of the stomach remains, but we're detouring the way the nutrition flows. It's a very powerful operation for people who need to lose a massive amount of weight. It's a powerful operation for people who have severe medical conditions like diabetes or sleep apnea. Unique limitation is that it's not reversible. We've changed the anatomy of your stomach. We've changed the way your nutrition flows through your body. And potentially that can lead to some vitamin deficiencies that we really have to keep our eye on long term. A third operation that we do is called the sleeve gastrectomy. And it's really intermediate in how aggressive it is and intermediate in the weight loss results. The sleeve gastrectomy is an operation where we remove 75 to 80% of the stomach. That gives us very significant weight loss. Unique advantage is that we're not dependent on a device. We're not rerouting the flow of the nutrition. But of course, its limitation or disadvantage, just like the gastric bypass, is that it's not reversible. Depending on the type of operation that someone has, recovery time can be from a matter of days to a week or two. The band, the gentlest operation, least aggressive, recovery is just in a few days. Almost all people get back to work in under a week. The sleeve gastrectomy recovery is about a week, but it depends in part on how physical their job is. Gastric bypass, more aggressive operation, recovery is about a week or two.
With respect to the risks of surgery, they're extremely low. In fact, the risk of not doing surgery, the risk of maintaining obesity and the medical problems that they have, that risk is higher than any risk of surgery.
With any surgical procedure, there is the potential for surgical complications. The potential complications for the band, number one, would be a possibility of erosion. Number two, slippage of the device. And number three, the device fails. With the gastric bypass, there's potential for leak, bleeding, and long-term possibility of vitamin deficiencies. The potential complications for a sleeve gastrectomy are leak and bleeding. So when lifestyle changes are combined with this powerful tool that surgery provides, we expect patients who are healthier, live longer, have more energy, and an absolutely better quality of life.
As a result of the weight loss, my relationship with my husband is just incredible. We do so many things together. We go out to the movies, we go dancing.
I feel great. I'm able to do things I couldn't do before.
This has changed everything.
A patient who has weight loss surgery can expect dramatic, life-changing results.
Before bariatric surgery, I weighed about 285 pounds. I've lost about anywhere from 85 to 90 pounds.
I was 300 pounds, now I weigh 125, and look at me now. And I'm enjoying it.
My husband bought a motorcycle, a Harley, in 2010, and I wouldn't get on it because I felt too big and I felt that he wouldn't be able to balance me. Now, I'm asking him to go for a ride.
It's actually completely realistic for someone who's had weight loss surgery and suffers from diabetes, high blood pressure, sleep apnea, for all of those conditions to be gone after surgery.
After the surgery, I no longer had high blood pressure. I no longer had high cholesterol.
I'm no longer diabetic. I no longer have high blood pressure.
My diabetes is completely gone. I'm no longer insulin dependent.
Often it's the little things that we may take for granted that some patients are really thrilled by. Things like sitting in a booth at a restaurant, being able to sit in a movie theater, get on rides at an amusement park, and of course being able to travel on planes.
I have so much energy now. I want to do more things. I want to go more places. I want to travel. I want to do things that I would never do when I was 251 pounds.
Had I known before that I'd feel the way I do now, I just kind of wonder why I waited so long.
If somebody asked me about the surgery and they wanted to know if they should have it, I would ask them, why are they waiting? I wish I wouldn't have waited so long.
I have a patient that really comes to mind that I think about all the time. He's a guy that was on a number of medications for high blood pressure, for diabetes. His ability to exercise and be active was severely limited.
Walking was a challenge, and just being able to walk around the block, take the dog for a walk, was tough.
He's a guy that went from all these limitations to getting off all his medications after significant weight loss, and then he started running.
Shortly after having surgery, one of the things they preach is to get up and start walking right away, and that's what I did. And so one block became 2 blocks, became 3 blocks, became a mile. Then I challenged myself by signing up for a 5K, decided that I was going to run a 5K, and that was the first thing I did 3 months after surgery, and I accomplished that.
It then progressed to running races. It progressed from there to running marathons.
This year alone, I've done 5 marathons and several half marathons, and in fact, I've done back-to-back marathons 2 weeks apart, and those are 26.2 miles. But I get it done. It's not something I could have done 3 years ago before having the surgery.
And in fact, he inspired me to run my first half marathon, and that was a couple of years ago.
It's a whole new life. It's being active, feeling good about yourself.
I've got a fun story, a patient I operated on who was initially over 500 pounds. He ended up moving away from our community to the East Coast. Well, when he moved away, he sent us this license plate that it says half the man, and now this is my souvenir of him.
I would like to say to you, thank you so very much, because you have saved my life and you have changed my life forever.
He's been an angel. If it wasn't for him, I would have been 6 feet under.
You've really changed our life for the better. And I would do it all over again if I had to.
And that's why I love to do this. This allows me to be a part of my patients' life-changing journeys. This is not an easy decision. I tell my patients not to take this decision lightly. It takes hard work, it takes dedication, it takes commitment. But the more energy you put in, the better your results will be. And if we can get these results, your life will be changed for the better.